Hello, my name is Kara Blackburn. I'm a registered nurse and midwife, currently working at the Women's Hospital.
Fantastic. Thanks, Kara, very much. You've just been a panellist at a discussion here at the hospital about health professionals and human rights and really what they can and should be doing for asylum seekers and refugees. You talked about your previous experience with MSF, Médecins Sans Frontières. Can you talk about that, where that took you and what you learnt from it?
I started working for Médecins Sans Frontières, or MSF, in 2006. And MSF is an independent international humanitarian medical aid organisation that provides basically healthcare for populations in distress and natural disaster conflict settings. I started working as a field midwife, going out to do long-term projects, 6 to 9 month projects. I started in North Sudan in the Darfur region, working in the middle of a very small, in a very big refugee camp in a small hospital, a small field hospital, and providing maternity services. After that, I started working in Sri Lanka during the Civil War, and it was particularly returning to Australia after that mission that I really became aware of the issues surrounding asylum seekers and refugee populations, particularly hearing the rhetoric in Australia about at the time about queue jumpers and economic migrants. And after seeing what I had seen in the north of Sri Lanka, I knew this was absolutely not the case for these populations that were escaping extreme levels of persecution. So I think that just really ignited my interest, or wanted to understand this further, and of course have witnessed the deterioration of policies in this country to the point where we're seeing extreme examples of severe mental distress and other issues to this day.
You talked as a midwife particularly about the impact of dislocation on women and girls across the globe. Could you expand on that?
Yeah, so it's well documented now, and we've seen this time and time again, that in settings of conflict or in population movement, women experience much greater rates of sexual violence. They experience much greater rates of pregnancy complications, specifically the birthing of low birth weight babies and the incidence of preterm labour. They of course then experience unwanted pregnancies as a result of interruption to contraception, and also because of sexual violence, rape. And of course, so we see that, and we have seen that time and time again in the settings I've worked with MSF, and that's why we've specifically targeted programs to look at these cases, to provide safe obstetric care, safe abortion care, family planning.
And the figures are pretty staggering.
The figures are staggering. There's 32 million displaced women and children in the world at the moment, predominantly because of these massive population movements from Africa into Europe, and the Middle East crises at the moment, where there's been millions of people leaving Syria in particular into neighbouring countries.
So in the context of the discussion today about really what can health professionals, particularly on the ground here in Australia, with this political environment, with this ethical environment, and with people still languishing in terrible conditions on Manus and Nauru, what do you see as the priority here for health professionals and for their bodies that support them?
Yeah, so I think as a health professional, we are in direct contact with these women in particular, who are presenting here to the Women's for Care during their pregnancy or whatever it may be, on this background of a long journey, languishing in refugee camps for 10 years or more. Many stories about that, moving through their journey into Australia or not. And really, I think there is absolutely a role for a much greater. I think health professionals really need cultural competence training, is I think what I'm trying to say. So I think there's very much a gap, I think, in the care that we have these women for at a very specific time for a period of a pregnancy, actually. So we have lots of time to actually see them and to understand what it is that they are experiencing from a mental health point of view, what they're experiencing physically from what they've been through, and I think we have to be a lot more attuned actually to the cultural differences that exist.
Before we talk about that, can you talk about who the women are? Are we talking women who have come from Nauru as well as people who have settled in Australia on the humanitarian assistance program?
Yeah. So I guess I don't have experience directly with Nauruan patients here in this hospital, although I'm sure they are around. I guess I'm just talking about more people that have obtained refugee status and have arrived in this country, but still are negotiating a healthcare system that they're thoroughly unfamiliar with, and in a language that they don't speak.
And where are the gaps in that competence?
I think an example I can give, I can give two examples, clinical examples recently. There was a woman I looked after in birth suite who had come in labour. She had been in this hospital for her entire pregnancy, so attending antenatal care as per schedule, but she had not disclosed during her pregnancy that she had female genital mutilation, which of course then had an impact on her ability to give birth, and there needed to be a plan in place. And that's despite actually having an African women's clinic here at the hospital that is specifically dealing with the consequences of female genital mutilation. And she had not felt safe to disclose this. So I think that for me really illustrated that these women have very specific medical and psychosocial issues that need exploring on a much greater depth. I think the other clinical issue we see in hospitals is fistula from previous childbirth experiences where they haven't been able to access care, and absolutely a plan needs to be in place for their safe delivery, and that needs to be identified early, and that's where I think things are offered, but I think it could be on a much broader scale. And I think certainly like cultural competence training in combination with a much broader package of activities would go a long way into helping these, because they are very specific to this population.
Where should that action come from? Who are you looking to for leadership on that? Is it individual hospitals?
I think as a clinician, I would love to see it happen within hospitals as a start, and I think we are in a privileged position to have actual access to this. There is not many other places that these women would access, and we have them for a period of time. And I think we can begin. Yeah, we can begin to address. I'd love to see it happening from initially a hospital point of view. Yeah.
And just from your experience working with MSF and the fact that they were asked to leave Nauru, and that there is real concern there's not an NGO or independent health care there. What's your worry about that at the moment?
I wasn't involved in the Nauru project at all, but from speaking to colleagues that have been on Nauru and were part of that project, both at the beginning of the project and at the end, the difficulties they had working in that environment were very clear, and they've been very clear upon returning that there is no mental health services for patients. The clinicians that are on the island either don't speak the language, or they've already got a full caseload and they are not being able to see any more people, which is why MSF was there to fill that gap. So it's very clear that now that MSF is not on the island providing mental health services, that there is nothing for the people that are there.
And that's a major problem.
It's a major problem, yeah. I mean, they have spoken out very recently about the absolute deterioration in children that they observed, and there is no one to care for them right now.
Do you take hope out of today's meeting?
I really do, actually, and certainly we've just had a meeting afterwards, which I think is really has galvanised us all to kind of reinvigorate this discussion and to try and see how we can work with our different coming from all very different backgrounds, working with colleges and other colleagues about how we can actually do something for this issue.
Fantastic. Thank you very much.
Thanks very much. Cheers.